Well, the fair always, of course, at Mack Park Fairgrounds, right across from the Indiana Regional Medical Center. IRMC CMO Dr. Richard Neff is with us this morning. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. Not only is it next to the Mack Park Fairgrounds, but it's actually a part of the fair this year. As always, IRMC will be there in a big way. Dr. Neff, good morning.
Good morning. How are you doing?
Wonderful. It's good to have you with us today.
Thank you. Glad to be back.
So you are going to be at the fair this week?
Yes, we are. Well, I will be there with my family to go ahead and look at some of the sites. And
Your first fair.
Our first Indiana fair.
There
This
you
is true.
go.
This is exciting for us. We always love county fairs.
Oh, good. Good.
So looking forward to it. But we're going to be there as far as Indiana Regional Medical Center is going to be there giving vaccine on Wednesday, Thursday, and Friday from 4 to 8 at the. We have an IRMC mobile unit that will be there with some patient information and also giving out vaccines.
Yeah, that's wonderful. Of course, IRMC always is there, and folks can get blood pressure checks and things of that nature all the time when they stop by. But the vaccine and its availability there is a really special part of IRMC's presence at the fair this week. It's so important. We hear the numbers all the time where Indiana County stands in relation to other counties, but really in relation to the possibility of getting or not getting or the severity of COVID-19, this is the time. If you don't have it now, you better really think about getting it.
We really encourage people to go ahead and get the vaccine. This is, at this point, a disease that in a good number of people that are elderly or have substantial medical illnesses that causes death. And we have a vaccine that prevents that death. So it is incumbent upon all of us to do what we can to continue to be vigilant about this, and the vaccine is part of that.
The vaccine, of course, is something that has been available now for a good 6 months or so for the general public, and now it's for those who are ages 12 and up, and its availability is still free, and so folks don't need to worry about the cost of that. You're actually offering it at the IRMC facility on Tuesday, right?
Correct. We are at the DriveThru where we do the COVID testing. In the evening from 5 to 7 we have a drive-up vaccine. We've been doing just under 100 vaccines, and we have as much as people want to be able to come and drive up at 5 to 7 on Tuesday.
We remember earlier in the year when it was just getting started and everybody was desperate to get it, and am I eligible to get it now? Trust me, you're eligible to get it now, and there's plenty of it for you. Let's talk about its effectiveness with what has come to be known as the Delta variant.
Yes, and the effectiveness, it continues to go ahead and be effective at substantially eliminating the risk of dying from COVID and substantially reducing the severity of the disease when and if people do come down with it. The vaccine does not prevent people from being able to catch COVID. It just makes it a much milder kind of disease.
Yeah. We hear, of course, stories of other medical facilities and the fact that their ERs, their ICUs are just crammed with COVID patients. The IRMC situation, how does that stand right now? And I don't know if you have this information available or not, but in terms of the number of people with COVID being treated currently who do not have the vaccine versus those who do.
At this point, we have 24 patients who are inpatient with COVID. 2 people are vented in the ICU at this point, and 2 of those 24, or about 10%, are currently vaccinated. They have other comorbidities that make them at a higher risk for developing severe disease, which is why it makes it even more important to do whatever we can to vaccinate ourselves so that we can try and prevent and protect those who are most vulnerable.
The irmc.org/vaccine website, again, remains the go-to place to find out about the vaccine and its availability. And the other day, while I was on that site, I noted the information about the booster shot. And this is a question that people have. Do I need it? Can I get it? Who is eligible for it? And who needs it most of all? Maybe you could fill us in on all of that.
Sure. And at this point, the booster is being provided for those who are significantly immunocompromised, meaning that they have an organ transplant, they are dealing with an active cancer that they're actively treating, or other like kinds of severe immunocompromised states. So later in September, we will probably start doing a booster for the general public who are, at this point, it looks like they're going to be doing 8 months out from their initial vaccine. So those that were vaccinated end of January into February will first be able to come through to get a booster.
Now, folks who had that shot initially or had the round of shots, the 2 shots that they needed, if they were to extend it to 10 months, 11, 12 months, can you extend it further than that 8 months barrier?
I think you can. It is, the Pfizer vaccine that we're giving out, it looks like its effectiveness has waned a little bit, and that's the reason for the booster, to try and go ahead and get those that are significantly immunocompromised or who have other comorbidities to be able to try and protect them most. And people, this is something that's important to note. 7 of our 24 patients that are currently inpatient are under 50. 5 of them are 40 years old or younger. We have the 2 people that are intubated are young people. This is a very serious disease and should not be counted as being mild and insignificant.
We talk about the COVID-19 coronavirus itself, the virus itself, mutating and finding ways to get into the system, and it seems to have found its way into the systems of younger folks than the first round of, I don't know, do you refer to the initial round as the alpha variant, if this is the delta variant or not? Whatever you call it, has it mutated to the point where it's looking for weaknesses in the human system and finding them in weaker people or younger people who have comorbidities or who simply haven't gotten the vaccine?
Well, that's an interesting question. I am not certain of that. I do know that the Delta variant is much more transmissible. So whereas before we talked about someone with COVID passing it on on average to 2 or so other people, this is looking like with the Delta variant of passing it on to 5 or 6 other people. So it's much more easily transmissible, which makes the vaccine important, but also makes distancing, masking, and adequate ventilation and not being in large crowds in enclosed spaces very vitally important.
That's an interesting point that you make there as well, because we have heard that people who are vaccinated against it and who don't mask up still, they might have the risk of having the virus within them, not being affected by it, but still being able to transmit it to somebody else. Is that true?
That is true.
All right. So
yeah.
Bottom line is you have the opportunity this week, and if you check IRMC.org vaccine in subsequent weeks as well, coming weeks, to get yourself vaccinated against the coronavirus and do your best to at least mitigate the effects of COVID-19 and maybe even eliminate it. And those opportunities come this week when you're having fun at the fair. How about that?
Indeed.
Yeah, a little funnel cake and a shot, and you're good.
That's right. I hear that Stromboli is a hot item there,
Telling
too.
you what, Stromboli will do it. I don't think Stromboli will actually affect COVID-19, but you'll be happier when you get your shot.
There you are.
Dr. Richard Neff, anything else people need to know about COVID-19, about the vaccine, about IRMC's advice or recommendations for dealing with it at this stage of the game?
At this stage, this is really hard. We are all incredibly tired of this, but the illness, the disease, COVID, does not care about whether or not we're tired about it. So like what we talked about from the very beginning, the kindness and sincerity of people looking out for our neighbors, that is what is really, really needed and important at this point.
He's Dr. Richard Neff, IRMC CMO. I hope to have you back sometime soon with maybe some better news about COVID-19 and our battle against it. Thanks for coming in today.
Thank you so much. Looking forward to it.
We appreciate it. It's the voice of Indiana County, WCCS 101.1 FM and AM 1160. Coming up, our health cycle in just a moment. We'll have the coronavirus crisis update from Fox. We also have Sarah Lee Kessler with Health Beat. Lisa Brady has Fox's House Call for Health. It's on the way. It's the voice of Indiana County, WCCS 101.1 FM and AM 1160.
We are back, the 158th Annual Indiana County Fair, because we